Good afternoon. I'm Kathy Bryant, and I'd like to thank you for joining us for today's webinar, Coronavirus 19, Answers to Your Risk Management Questions. As we go through the webinar today, please keep in mind that we're not offering medical or legal advice. What we are trying to do is to bring you current up-to-date information as possible. As you know, the coronavirus is a rapidly changing environment, and details related to what we know about coronavirus change virtually daily. The information provided in this webinar is the most accurate that we can provide you on March the 12th, 2020. And our best advice is that you use your internet resources that we'll be discussing as you go forward from today, because those do change. In this webinar, we're going to be discussing how you can share patient information from a HIPAA perspective, some common questions that you may be getting from employees as well as patients. The number one thing I want to stress is you need to have a reliable source of information. In the webinar, whenever you see a slide with the paperclip on the left, that icon, that will tell you that there is a downloadable resource provided, and they're on the left-hand pod, including the slides from today's program. The three main websites that I would refer you to are the CDC, Center for Disease Control and Prevention website, the Texas Department of State Health Services, and the Texas Medical Association. All three of these websites have put tremendous effort into organizing their COVID-19 or coronavirus information to make it easy for you as a provider or as a medical practice. And probably the most important thing to take away is that having reliable sources of information is the key to keeping information flowing in your organization. So we're going to start with HIPAA. We're going to talk about sharing patient information from a HIPAA perspective. All the way back on February 3rd, 2020, the Health and Human Services Office for Civil Rights produced a document and sent it out through a web link about sharing information as far as it related to HIPAA privacy and coronavirus. And we're just going to go through the highlights of that, but that one is available as a downloadable file as well. Under the HIPAA privacy rule, covered entities may disclose without a patient's authorization protected health information that is necessary to treat the patient or treat a different patient. So that means that if you have a patient that has called you or is in your office and they are significantly ill and you need to transfer them to an emergency department, then you need to call the hospital and coordinate how that patient is going to be arriving and where they should enter the facility. If you share information regarding this, there should be no fear of problems with HIPAA down the road. That is certainly for the treatment of the patient. You can share information with public health authorities. The HIPAA privacy rule recognizes the legitimate need for public health authorities and others responsible for ensuring public health and safety to have access to PHI that is necessary to carry out their public health mission. The privacy rule permits covered entities to disclose needed PHI without individual authorization to public health authorities, such as the CDC, a state health department, or a local health department. For example, you may disclose to the CDC PHI on an ongoing basis as needed to report all prior and prospective cases of patients exposed to or suspected or to have confirmed the novel coronavirus. So you may ask, is the coronavirus or COVID-19 reportable in Texas? The answer is yes. It is reportable. It must be reported, rather, to your local health department. If you do not know where to report it in your area, the Department of State Health Services website listed here is available to give you all of the different local health departments within the state of Texas. So can you share PHI for disclosures to family, friends, and others involved in the care of an individual? So when it comes to notification, a covered entity may share information about a patient as necessary to identify, locate, and notify family members, guardians, or anyone else who is responsible for the patient's care, as it concerns their general condition or even death. This may include, where necessary, to notify family members and others, such as the police, the press, or the public at large. We're going to talk specifically about notifying the media in just a couple of slides. You should try to get verbal permission from individuals who are able to provide that, or reasonably infer that the patient does not object. If the patient is incapacitated, that's obviously not going to be possible. A health provider may share relevant information about the patient with family, friends, and others involved in the patient's care, or for payment for the care, if the health provider determines, based on their professional judgment, that doing so is in the best interest of the patient. And certainly there are other examples where you can notify organizations such as the Red Cross if they're assisting in notifying family. When it comes to sharing information or making disclosures to the media, you really need to do that only with the patient's written authorization. For example, if you got a call from a local news media asking if you have a specific patient in your practice, or if you have a specific patient that has been diagnosed or suspected of having coronavirus disease, unless the patient has given you written authorization to release that to the media, you should decline to be interviewed or decline to answer the questions. It's always in your HIPAA best interest to not even acknowledge that the patient is a patient of your practice. As with any disclosure, we would encourage you to limit the disclosure to the very minimum amount necessary to accomplish the purpose. For example, a covered entity may rely on representations from the CDC that the protected health information requested by the CDC about all patients exposed to or suspected or confirmed to have coronavirus 19 is the minimum necessary for the public health purpose. In other words, you don't need to provide all their past medical history, only specifically related to the question being asked. In any emergency situation, covered entities must continue to implement reasonable safeguards to protect patient information against intentional or unintentional impermissible uses and disclosures. Further, covered entities and their business associates must continue to apply administrative, physical, technical safeguards of the HIPAA security rule to electronic protected health information. There are additional resources that are listed on the bulletin, and we have listed those here for you as well. It's really sad to learn that cyber criminals are taking advantage of the pandemic situation by issuing phishing emails. It's been several days since it first came out that there were fake emails circulating under the name of the World Health Organization about coronavirus. But the example shown here on the screen is an example of a phishing email that has been widely dispersed. There are a lot of good articles available on the phishing emails specifically as they relate to coronavirus, that if you're interested or you have concerns about a possible phishing email, there are lots of resources available. I think one of the biggest things that we'd like to discuss today is preparing for coronavirus in your practice. This is actually one of the downloadable documents off of the CDC. Keep calm and wash your hands. If only it was that easy. But I think the very popular saying of facts, not fear, really does apply when it comes to preparing for your practice. Not only are you preparing your practice, but often physicians as community leaders are being called on to answer questions for groups and organizations that they are a part of. And it may go well beyond just your practice. So let's start by looking at the CDC's Crisis Emergency Risk Communication Guidance. This document is one of the downloadable resources and is also available on the CDC website. The 6 steps are very straightforward. The first is be first. Quickly share information about the disease outbreak and how you can help spread the disease or help stop spreading of the disease and prevent and reduce illness from the disease. And this would certainly apply to your office. Second, be right. Accurately establish credibility. Information should include what is known, what is not known, and what is being done to fill in the information gaps. Number 3 is be credible. Honesty, timeliness, and scientific evidence encourage the public to trust your information and guidance. I think one of the biggest questions that still remains is how long does the coronavirus live outside of the human body? And there's some studies that are starting to come forward, but most of those have not been peer reviewed, so they've not been included in today's webinar. Number 4, express empathy. Often when there are disease outbreaks, fear causes disruption in our daily lives. And in cases such as coronavirus, we don't know everything we need to know. So acknowledging what people are feeling and their challenges shows that you're considering their perspectives when you give them recommendations. Number 5, promote action. In an infectious disease outbreak, public understanding of and action on disease prevention is key to stopping the spread. And number 6, show respect. Being respectful in your communications is particularly important when people feel vulnerable. Respectful communication promotes coordination and rapport, and actively listening to issues and solutions brought up by local communities and local leadership further your credibility. I think from your perspective of your practice, educating your patients on and making sure that they know how to prevent coronavirus cases from coming into your practice is key. The CDC website is full of information about what you should do if you're sick or if you get sick from a patient perspective. But how you translate that to your practice is important as well. Maybe it's time to write out scripts for staff members so everyone from the person who answers the phone to your back office staff all have the same message and are giving the same consistent message. Stay home and call your physician is number 1. Tell your healthcare provider and let them know what your symptoms are. If let the patients explain to you if they have been exposed or in an area where there's a high risk of exposure. You can push messages out to your patients through things like your patient portal, your message on hold, your website, and after-hours phone messages. A very good document that I would encourage you all to go to the CDC website to download is the Community Mitigation Strategy document. I did not include this document because literally it changed overnight, and so I want you to be able to get the latest information. But this document breaks down mitigation activities by the type of facility, in this case, the healthcare setting and healthcare provider. And it breaks it down into 3 categories of the number 1 being there's no coronavirus known in your community. The second being minimal to moderate coronavirus activity. And the third being substantial coronavirus activity. If you are lucky enough to still be in the first category of no coronavirus known in your community, you're in the preparedness phase and you need to take advantage of this phase to get as much in place as you possibly can. You need to plan now. We don't know how long coronavirus is going to be a problem in Texas and in the United States, and quite honestly, in the world. So you need to prepare for the new normal. That includes using reliable sources of information, as we already discussed, developing scripts for your staff members. Review and reinforce your existing infection control and prevention policies and procedures. Training and retraining staff with reminders on infection control, hygiene, and your office's plan. Review your inventory of personal protection equipment, PPE, and use it only when it's needed. We are well aware that there are significant shortages of PPE in the world right now. and even things as simple as hand sanitizer are simply unavailable. So only use the PPE when you need to. Consider evaluating telemedicine or using telephone consultations as an alternative to seeing patients in your office. Develop a plan for temporary staffing through something like an agency or cross-training your staff if your staff becomes ill or must be quarantined. And you may want to investigate your business operations insurance for business interruption coverage should your practice not be able to see patients at all. I will just mention that your TMLT medical professional liability insurance coverage does not cover business interruption. And the business interruption coverage under your cyber insurance policy would not be uh, applicable for coronavirus. There is a really good article to help you prepare on the TMA website when COVID-19 visited this physician's Houston practice. Lessons learned. As we know, the first cases of coronavirus disease were diagnosed in the greater Houston area. And literally, this is a practice's recounting of what happened when the patients showed up in their office. Another TMA document that might be helpful for your practice is the Disaster Planning Toolkit, Preparing for the Unexpected. As mentioned earlier, you may want to consider alternative ways to see patients, such as telemedicine. Make sure that you're using a HIPAA-compliant video conferencing service. Don't just start FaceTiming with your patients. You need to obtain a business associate agreement prior to the use of telemedicine. You need to ensure your video conferencing provider uses end-to-end encryption on their software. And there could be other special features such as two-factor authentication to ensure that access is restricted only to those who are actually supposed to have it. I think it's wise for you to consider posting something at the entrance to your clinic to let your patients know that if they think they have been exposed to the coronavirus, they need to let you know. They don't need to simply sit in your waiting room. TMA has provided posters on their website, not only in English, but multiple languages that are available for download, and the English version is available on our download pod. I've already mentioned that employee personal protective equipment, or PPE, is in short supply or back ordered. Anything that you can do to create space or a barrier between you and a potential coronavirus patient is helpful. Don't forget even the very basics of frequent hand washing and using good cleaning and disinfecting methodologies in your clinic. If you use an outside company for cleaning your offices after hours, you might want to make sure that they are adding a level of disinfection at this time. The CDC has issued a very lengthy document on healthcare personnel with the potential exposure to COVID-19. This document has been updated a number of times, most recently March 7th. And again, this is one of those documents that you want to make sure that you're actually receiving the most accurate information. So if you would just download that off of the website and or review it on the CDC website, it would be important. We've had some questions about OSHA as it applies to the coronavirus. You have a duty to maintain a safe and healthy work environment. You can send employees home if they exhibit symptoms of a contagious illness, even if the employee wants to stay at work. You can adopt a policy that all employees with a potentially contagious illness must not come to work. You can require employees to stay home for 14 days after possible exposure. And you can require a medical release to have the patient return to work. Or, I'm sorry, the employee return to work. Another question is, can an employee refuse to come to work due to concerns about the coronavirus? And the answer is, it depends. Is there a potential risk of exposure at work? Certain patients may have protection under the ADA, such as such as employees with compromised immune systems, and they may request a reasonable accommodation of working from home, and that would be something that you would want to potentially or consider honoring. If an employee is diagnosed with coronavirus, what can I tell other employees? As a general rule, you do not want to disclose the identity of the employee diagnosed with or suspected of having coronavirus. Under the ADA, employee medical information must be kept confidential and may only be shared in certain circumstances. From a HIPAA perspective, if the person is your employee and you are their medical provider that diagnosed the coronavirus disease, don't forget that the HIPAA requirements apply. You can tell your employees that there's been a suspected or confirmed case of coronavirus disease in the workplace. You can tell them that we are taking all appropriate steps to manage the situation in accordance with the CDC and local health department guidance. You may want to designate a specific person, such as HR, the administrator, or a physician, for staff to go to if they have questions, and that person then would be delivering a consistent message. Employee communications really is key. You need to establish how you're going to communicate. Is it going to be in morning huddles that as you start your day, everyone is receiving the same information before you start seeing patients? Are you going to send out text messages? Are you going to send out some kind of communication through your EMR or EHR messaging system? You need to provide employees with frequent updates on what your practice is doing about coronavirus. Provide fact-based information from reliable sources, because the goal, after all, is to reduce employee fear, anxiety, rumors, and misinformation. Undoubtedly, you're already getting questions from patients about coronavirus. The CDC's guide has a one-page document, What to Do If You're Sick with Coronavirus Disease 2019. That is a really good document to be able to give to patients, whether you provide it to them through your website, push it to them through your patient portal, or even emailing it to them if that's their desired choice of or source of communication. or just letting them know how to go on the CDC website to find information. It's really important that they know what they need to do to take care of them if they are suspected, presumptive, or positive for coronavirus. You should expect special populations to have questions. One question that we've received is, I'm a pediatrician. My office received a call from a new mother scheduled to bring her newborn into the office saying, have you had any coronavirus patients in your office? And what can you tell her? Simply, you need to be honest. If you have had a coronavirus patient, you can say what you have done from a cleaning and disinfecting process. But you also can be sure and tell your patients what you're doing from a telephone triage, deep cleaning and disinfecting on a routine basis. Are there other options to coming into the office with a newborn, such as telemedicine or home health care? And be sure and include what the risks of not coming into the office for an appointment might include. Likewise, we're hearing that persons over 60, especially with comorbidities or chronic illnesses, can be at higher risk for developing complications from coronavirus. So patients may call with questions such as, I feel fine, but I'm over 60 and I have heart disease and diabetes. Should I keep my routine checkup with my physician and risk the chance of being exposed to coronavirus in the office? Again, you want to explore the options for coming into the office. Maybe postponing the appointment is appropriate. Is there an option of using telemedicine? Again, home health may be an option. And certainly, if a patient simply is refusing to come, you can explain the risks of not coming into the office for follow-up appointments. TMLT is committed to helping you work through the risk management issues that you're facing with coronavirus and coronavirus disease. And we would encourage you to follow us on social media because that is our quickest way of pushing out new information. We will also be posting additional resources as they become available on our resource hub at hub.tmlt.org. We know that you may have other questions as time goes on,